We very much recognised we wanted local tobacco alliances leading work on the ground. This wasn't just a regional team, it had to absolutely be bedded across all of our localities. So from having 3 in 2005, we now have the whole region covered by 12 local tobacco alliances, and they play a really vital role to draw together key partners like councillors, trading standards, environmental health, the Children's Trust, the Stop Smoking Service, the Fire Brigade, the patient groups, you name it. I would say anybody who has an interest can be part of this. It's not hierarchical, it shouldn't be down to what your profession is, anybody. They have a clear plan of action linked into the regional programme, and those that function the best are the ones that are strategically linked and have key decision makers championing the cause. In terms of supporting capacity building and increasing skills and knowledge, over the last 5 years we've had lots of events, regional forums, networks, conferences, training, and I hope it has paid off and it hasn't just been more conferences, because over 4,000 people have now participated in our programme of work. We build the case and make sure that we always speak out. Shy Ben's getting out, is what my granny used to say. So absolutely, we made the case for why we needed a comprehensive smoke-free legislation. And the picture there to your right is a local councillor from Gateshead. He's shaking hands with and he runs a newsagents actually. This is him in Ireland, shaking hands with an Irish retailer, finding out that actually all of the newsagents haven't closed in Ireland because they've put these cigarette products out of sight. And we are continuing to make that case now because it is a real risk, the health act around point of sale advertising, unless the public health community speaks out and says this is about protecting our children from advertising. We'd harness the media at all stages, keeping it fresh with new news and newsreel local people. The picture on the left is actually a TV advert that we ran back in 2004-05 to really establish the case for why workers needed to be protected from second-hand smoke. More recently, the other picture is actually a People Like Me campaign. Feel very passionately that this is about real local people. In the last year, 15 local people have really worked very closely with us. This is Brett Johnson. He quit smoking with the County Durham Stop Smoking Service. He has now become such a huge champion. He's done TV for us, and he's got such credibility because from his heart of hearts, he tells what his story as to why he's so pleased he quit and how desperate he is that he doesn't want his kids to get hooked. Keeping it fresh with new news and in partnership. We have a great partnership with the Northwest, which has achieved huge economies of scale in being able to buddy into other areas. And this is in the last month, actually, both regions have run a campaign around why basically the simple messaging in terms of take your smoking outside and practical support around how to do that if you're smoking in the home. I feel very passionately that we must keep taking the pulse of our public and listen to real people, never get too far ahead of where the public's at and don't become too evangelical about it. We've done a huge amount of opinion surveys, consultations, focus groups, tracking of campaigns, the face-to-face engagement, which I think is one of the most satisfying elements of the job, and using our community champions to speak out. And I think it's about having had a clear strategic plan. In the run-up to the smoke-free legislation, we had clean air awards for workplaces, and now we've got a programme of work around smoke-free families. But there are new challenges for us, and particularly in the North East, we have a real market in illicit tobacco, which is linked into crime, into local crime and disorder, and we've recognised this. And unfortunately, with our work that we're seeing, it's about 64% of smokers are saying that they can continue to smoke because they're able to get such cheap illicit supplies. So we've been working on a world-first programme across the whole of the north of England to tackle illicit tobacco. And this is an example, the packet in the middle. Those of you who don't smoke may not be aware of the cheap whites market, but this is a brand leader. It's called Jin Ling, and in a lot of our poorest communities in the northeast, this is what people are smoking. It's totally illegal, totally made for the illegal market, no health warnings, no duty paid, and we've even got CCTV footage of a 4-year-old being sold this. And our campaign here is around, getting communities talking about this in terms of if there is concerned about a crack house, if they can be that concerned about a tab house. It's one of what we have. So basically people selling cigarettes to anybody from their houses. We've been tracking progress and having independent academic evaluation along the way, and I think we're very fortunate in the UK to have the UK Centre for Tobacco Control Studies and have some fantastic academic expertise around this. So the really important thing is, has smoking actually gone down in the North East? Well, you will be aware there is always a time lag in terms of the general household survey. But at the starting point, we had the highest smoking rates in England, 29%. And we've actually had over the first 3-year period, this is the latest official GHS data, a drop in prevalence of 8%. Which is the biggest, fastest drop of any region in the country. And if you go back to that anti-cap image, and I think back to when I was setting this up and people saying, you're never, ever, ever going to get smoking rates to go down. It has been phenomenal. And if you think about the potential of the lives saved from that, interestingly, the men in the North East have been quitting en masse, and we actually have the lowest smoking rate of men in the country. Female rates are going down as well, but not as fast as I would like to see. But overall, phenomenal drop in prevalence as such, and it's being backed up by local prevalence surveys that are being undertaken and other sources. So first couple of years I thought, oh, it's a statistical blip, but now absolutely there's a real strong sense that there has been a massive shift around this. In terms of the impact on morbidity, mortality, the North East is narrowing the gap in terms of CVD faster than any other region in England as well, which I'll just skip through these. And in the last year, the services, which play an incredibly important role, have just had their busiest year on record. In actual fact, nearly 13% of all smokers in the North East have gone to their local stop smoking service, which is great. I talked about media and communications, and I think this is incredibly important in public health, that we keep reinforcing the positive things that we're trying to achieve, etc. And we've been really fortunate that we've had such strong support from our media. And in terms of getting as much earned media as possible, it's going to be very important now. I think the days of some of the big national mass media campaigns have gone, but getting as much free media as possible using real local spokespeople. So in the last year, we actually got about £3.5 million of free media just from putting out our press releases and always being there to champion the cause. So the last 6 years, been a real smoke-free social movement is going on, and it's been achieved through NHS, local government, private, third sectors, and our local communities working together for this. The region as a whole and all of its partners have been recognised by achieving the gold medal from the CMO inaugural Public Health Awards. The success comes from sticking to the recipe. It's a unified programme. It's not a collection of independent interventions. It's designed and implemented as where all of the parts complement and reinforce each other. You absolutely need individual behaviour change plus population level measures. We need to ensure that this effective working is commissioned in the new era of public health service. Localism was very important, but we must ensure there is collaboration across boundaries, avoiding duplication and fragmentation. And there is a real good appetite to maintain this. And this needs to be the recipe for the next 10 years. And I think if we think through what the vision could be, stick to this principle, keep building new allies and partners, there are real opportunities ahead. And smoking kills half of all long-term users and is the single biggest cause of inequalities and death rates. We need to keep pushing for a future free from tobacco use, which will mean our children will not die early and unnecessarily from smoking-related illnesses. And irrespective of political changes, reconfiguration, the health needs, the health priorities don't change. Hold true to that vision and we can make smoking history for our children. Thank you.